One of the most common problems that a lot of women do not know much about, or a lot of women haven't even heard of it, is a condition called polycystic ovary syndrome. Women who have irregular cycles, or they have a history of missing a lot of cycles, or they have overt pelvic pain, are often found to have this condition.
Before I came to Dr. Lux, I was having a lot of irregular periods, and I couldn't even walk sometimes because my pains were just really, really bad. They were sharp, and just getting around, it was just really hard for me.
Now, in Marley's case, she came in about a year ago with symptoms that are very typical of PCO, and that consisted of irregular cycles and pelvic pain. We did an exam, pelvic sonogram. Turned out that she has polycystic ovaries, and she also had some findings I thought might be typical of some other conditions that can cause pelvic pain, such as endometriosis.
So Dr. Lux sent me here and had the sonograms. And then after I had the sonos, and it showed that I did have the polycystic ovaries, which was cysts around my ovaries. I had one big cyst, but then I also had several different little ones too.
Treatment of PCO and pelvic pain consists of a surgical option versus a conservative option. It depends on what your goals are, it depends on the severity of the symptoms. In her case, she was in pain, and she wanted to do something about that.
I went in the Thursday before and had the pre-op, and then after I had the pre-op done, they kind of told me, you know, how long I was going to be out of work, and I was only out of work a week. I was there like probably an hour after the surgery in recovery, and then I was able to go home that same day. If any woman is having pelvic pains, I highly recommend seeing Dr. Lux.